My article was the Lee Silverman voice treatment versus standard NHS speech and language therapy versus control in Parkinson's disease. The article focused on the effectiveness of generic speech language therapy and Lee Silverman voice therapy for those with a Parkinson's diagnosis who have related speech and voice problems. The study was completed in the UK. The article was significant and really interested me because as a future clinician, my goal is to work with the geriatric population. Therefore, I will most likely be working with patients that have Parkinson's diagnosis or diseases that have similar effects on speech, language, and cognition. The hypothesis that the article investigated is the feasibility and acceptability of randomizing people with Parkinson's who have related speech or voice problems in using Lee Silverman voice treatment and standard speech and language therapy, therefore measuring if there is an overall effectiveness of either therapy compared to a no-intervention group of Parkinson's patients. The authors investigated their questions by comparing 3 randomized groups, 2 controlled consisting of those given regular speech-language therapy and another receiving the Lee Silverman voice therapy, and 1 control group. The Lee Silverman voice therapy intervention group received 16 sessions of 50 to 60-minute therapies over 4 weeks, with extra home practice. Then the standardized speech and language therapy intervention group received specific therapy depending on the individual patient needs, however not exceeding 8 weeks of treatment. The control group received standard care but no added speech and language therapy for at least 6 months after the randomization. Outcomes were measured at the pre- and post-randomization at 3, 6, and 12 months. Outcomes came from participant and therapist completed questionnaires and measures, also from focal assessment of intelligibility of dysarthric speech, loudness, and comprehensionability. Although this was a groundbreaking study in the field, it was also a pilot trial, so therefore the effectiveness of the 2 therapies were not yet established. As mentioned in the article, the data that was collected is of vital importance to future clinical research in the field and is important for the next phase of testing. Strengths of the study that were mentioned express that within the field there is a lack of well-designed randomized controlled trials, and this specific study has been the most rigorous RCT to date. Therefore, this study has allowed for significant knowledge to be gained in the field that hasn't been previously looked in by researchers. A limitation that I found of the study would be the lack of participants. I found it was hard for researchers to find appropriate candidates due to the fact that Parkinson's is such a rapidly changing diagnosis. The evidence and participants that the study did have available was quality and reliable. However, they did not have enough evidence to make a conclusion. So since it was a pilot trial, I am extremely interested to see the outcome of the treatment and if it is effective enough to be continued being used on Parkinson's patients in the future.